Hi, my name is Dr. Larry E. Wilkins. I am a chiropractor and I'm a disc specialist. Now, I have made this video available for everybody on the web for a lot of reasons. Number one is a lot of patients can't make it to the office to see the video or see the seminar live. And a lot of the patients also who have back pain, neck pain, you guys need all the information you could possibly get before making a decision as to what kind of treatment is actually right for you. But more importantly, I see severe patients on a daily basis, and when I ask these patients what their doctors have told them, and these are patients that have actually been to neurosurgeons, orthopedic surgeons, chiropractors, they say they don't really know too much about what they have or what's going on with them, and they're scared to death. I deal predominantly with people that have disc problems, either in the neck or the low back. They have herniated, bulging, degenerative discs. The disc is what's causing the person to have most of their problems. Now, as research will tell you, and I'm a research nut, I read 30 to 40 research articles a month. Research will tell you that most of the problems that people have cervically, which is the neck, and low back, are all created because of the disc. Either the disc is herniated, the disc is bulging, the disc is degenerative, pinching a nerve, something along those lines. Usually at this point in time, I usually tell my patients when I'm having a live seminar that if you have a question, don't worry about the question. I'll stay till midnight if I have to answer all of your questions. You have an opportunity, unlike their opportunity, and that's this. If I don't answer your question during the rest of this seminar, shoot me an email at www.wilkinsspinalcare.com, and I'll send you back a reply as fast as I possibly can. What we're going to be talking about in this seminar is this. I'm going to tell you what types of conditions that we treat in this office. I'm going to tell you what axial decompression is and what the DRS system is. I'm going to tell you how the disc actually gets into trouble, and then I'm going to show you what we're going to do in order to fix that disc. And you'll have a good idea of exactly what we do in the office for the patients who have the disc problems. First thing I want to tell you about axial decompression, it's not a chiropractic procedure. This is a procedure that was developed by medical doctors, and actually the first table that was invented was by Dr. Alan Dyer. He's an anesthesiologist in Canada, and he invented the first table actually for himself called a VAX-D table. And I'll get into his story a little bit later when I explain to you what axial decompression and the DRS system actually is. And I started to use these procedures, and I found out that they were extremely helpful for patients who nothing else seemed to work for them. And after about a year of really great results, I wanted a little bit more, and that's when I discovered the DRS system. Now, in our office, we see miracles happen on a daily basis. We treat patients who have chronic pain. Now, chronic pain, all that means to you, so that you understand, is this. Chronic pain means that you've had that pain for more than 90 days. Now, most of those patients who have that chronic pain, the pain is pretty severe, and they're dealing with the pain on a day-in, day-out basis, and it kind of robs them of their life. They have no life. They go to work, they deal with the pain. They go to work, they deal with the pain. They're not able to do the things that they actually want to do. So that was the reasons that I found for doing the axial decompression. Absolutely phenomenal. Those are the different types of patients that we take care of. We take care of patients that have had surgery. We take care of patients that have been told that that's the only reason or the only answer to their problem, and anything in between. Anything that deals with the head and the neck, the low back, those are the conditions that we actually treat with the axial decompression. Now, having said all that to you, I'm going to go into explain to you the different types of conditions that we treat with the axial decompression and the DRS system. The conditions that we treat are herniated disc, bulging disc, degenerative disc disease, fell back surgery syndrome, facet syndrome, sciatica, and back pain and neck pain of unknown etiology, which are big words, and all they mean is no one has a clue as to why you have the pain, and also stenosis, all right? So those are the conditions that we treat. Now, the symptoms that you can have with the cervical spine are this, and the cervical spine just means your neck. You can have headaches, dizziness, lightheadedness, ringing in the ears, blurring vision, pain or numbness down the hands, arms, and fingers, pain into the chest, pain between the shoulder blades, shortness of breath, things along those lines. Now, low back. Low back, the symptoms that you could have with low back are these. You could have pain in the low back, pain into the groin area, pain into the hip area, pain down the legs, numbness, tingling into legs, toes, feet, indigestion, heartburn, diarrhea, constipation. And those are just some of the things that you could have with low back conditions and also cervical. So those are the kind of symptoms that a patient can actually have. Now, how axial decompression actually gets started by, and I told you about his name earlier, his name is Dr. Alan Dyer. He was an anesthesiologist. He was in a wheelchair and couldn't get out of the wheelchair. He went to, this was in 1975, he went to 3 of his friends that were surgeons and said, "What would you do with me?" And they said, "We really can't tell you what we would do, but we'll tell you what not to do. Don't have surgery." So he didn't. He went home and he developed the first decompression table, and it was called the VAX-D table. And he was the Deputy Secretary of Health in Canada at the time. He also invented the defibrillator, so he's a very sharp cookie. Now, when he developed that, he put himself on it. He was the first patient. After he was on this table, that was in 1975, he's never been in the wheelchair since. He's still practicing axial decompression, only he moved to where it's a little bit warmer. He's in Tampa, Florida now, but he's 80-some years old and he's still practicing axial decompression. So that's how it actually got started. Then when it came to the United States in 1995, 96, somewhere right around in there was a neurosurgeon by the name of Dr. Norman Shealy. Now, Dr. Norman Shealy has a back pain clinic in Springfield, Missouri, and he picked up the work. But when he started to look at this procedure, when Dr. Dyer was doing this, you had to lay on your stomach and hold on with your hands and arms while this procedure was being done. And Dr. Shealy, the neurosurgeon, didn't want that to happen, so he turned the patient over on their back, used a double belting system. Now, when he used a double belting system, he took the patient's participation away from the whole procedure. Now it is a procedure where the patient does absolutely nothing. So that's actually how axial decompression came to be. Now, the doctors who use axial decompression are neurosurgeons, orthopedic surgeons, pain management, physiatrists, anesthesiologists, chiropractors. Everyone uses the same procedures, and they work extremely well. Now, as I said earlier, I wanted a little bit more for my patients than just the axial decompression. After 1 year of doing that, I sought out a system, and I found the DRS system. Now, the DRS system was developed by 2 doctors. Dr. Norman Shealy did an awful lot of work on it, and so did Dr. Richard Bush, who's a chiropractor in Fort Wayne, Indiana. They did extremely large amounts of research into what would actually work best for the patient. And these are what I use in my system for the DRS. Now, remember that DRS just stands for decompression, reduction, and stabilization. You decompress the nerve, take the pressure off of it, reduce the size of the herniation or bulge, and then stabilize the whole thing with exercises. Talk about what causes the disc to get into trouble. Now, all discs get into trouble the same way, whether it's a cervical disc or a low back. So it really doesn't matter which one that you have. It's compression that does that to it. Now, I have my little plastic model here to show you exactly what happens to that disc. This is a vertebrae right here. This is a disc. This is a vertebrae disc. This little guy right here is the spinal cord. These are spinal nerves right here that come out through the foramen, which is just a little hole there for them to come out of. How the disc gets into trouble is this. It's called compression. Over all the things that you do, you keep compressing that disc smaller and smaller and smaller and smaller and smaller and smaller. Now, I'm going to draw this out for you so it will make a little bit more sense, but I want you to get the drift of it first. How it becomes smaller is, this is a compression. You put it under forces by lifting, twisting, bending. It could be all at one time, boom, you fall down the steps. It could be an automobile accident that causes the disc to get into trouble, or it could be a succession of 25 to 30 years that you keep doing the same things over and over again. It gets smaller. The liquid part of the disc, which is called the nucleus pulposus, just a big word, it means the liquid part of the disc. it starts to elongate out. When it elongates out, then it puts a little bit of a crack into the cartilage, which is called the annulus fibrosus. That crack in that cartilage allows that liquid part to push that crack open and open and open until eventually you get a little bit of bubble on the outside of it. That's your herniation or your bulge. Now that bubble cannot give you any pain unless it touches this guy, which is the spinal cord, or these spinal nerves right down in through here. If it doesn't touch those, you don't have any pain. Now all a bulge is, so that you understand the difference between a bulge and a herniation, is if you took a inner tube of a car tire and you left half of the air out of it and you pushed it, it's going to bulge the whole way around there. That's analogy that I use for letting patients know what a bulge is. Herniation is just a more confined area and a little bit larger, and it pushes back into the cord or the spinal nerves, and that's what causes it. All right. What I do with the axial decompression is this. I'm going to take and pull this herniation to the inside, to the liquid part where it's supposed to be. Now how I do that is using the tables that we have, the axial decompression tables. The table downstairs, what it's going to do is this. It's going to pull these discs apart like this. Now obviously it's not going to pull it that far, but I'm making it so that you can see it. I'm going to show you with my hands what actually happens. The disc is going to come apart like this, go back together again, come apart, back together again, come apart, back together again, 16 times on a 25-minute cycle that you're laying on the table. Now I'm going to go over this one more time with you again. There is no pain. Most of my patients actually fall asleep during this procedure. They know that it's doing something, but they don't feel any pain when it's doing it. But it actually pulls the disc apart. Now obviously I made that larger than what it is so that you could see it. The next thing that happens is this. When you create that, that's a vacuum. When you pull it apart, you create a vacuum. It's the reverse of what you see in a TV movie where the door comes off the plane and everything's sucked outside. This disc is sucked to the inside. Now, it's a slow vacuum which allows nutrients, oxygen, and water to spin this back into a circle again. And that's called hydrating the disc. Seeing everything that I've given to you in the seminar, which I've told you what conditions we treat, what symptoms you could possibly have, what axial decompression is, what the DRS system is, how a disc gets into trouble, what we're going to do in order to fix that. After you've seen that, you only have 3 things that you could possibly do at this point in time. Call our office, get set up, get an appointment so we can examine you. Now we have a standing deal in our office, and that's this. Anybody that's examined, I'm going to let them know that day whether I can help them or not. Now I'm not going to give you a full report that day, but I'll just let you know whether I can help you or not. All right? And as I said, we have miracles happen in this office on a daily basis. So it's just some wild stuff that we see. The second thing that you could possibly do is this, is I didn't answer your question, so shoot me an email and I'll give you the answer to that. Or you could go on the web that you're already there, check out our seminar schedule, and come into a live seminar. This lady came in to us and she had fusion surgery done to her cervical spine, which is the neck. And I took a look at everything and did an evaluation, and I knew that we could help this lady, and we started to work with her. 3 or 4 visits into care, she says, "Hey, I want to tell you a story." And I said, "Well, I'm always up for a good story." And she says, "Well, 3 weeks before I saw you on the web," she said, "I was going to commit suicide. I took the pills, I did everything, but the pills didn't work." I said, "God wasn't ready for you yet." And she says, 2 weeks after I did that, I found you on the web. Now, she is 100% right now, has absolutely no pain in her neck. That's the reason I do the seminar. I put a lot of time, energy, and effort into it because I truly want to help patients. So call me today at 724-547-3377, and I'll be glad to talk to you. Send me an email right away at www.wilkinsspinalcare.com, and I'll shoot you back an email as fast as I possibly can.